Okay, do listeners understand that Dr. Downs is a cosmetic surgeon? They question odd things not relevant to his specialty.
Well, that's a great comment because that is something that a lot of people are ignorant about, and it needs to be cleared up. And I am not a cosmetic surgeon, and this is I think it's important for your listeners to understand that there is a significant difference between people that are out there calling themselves cosmetic surgeons and then plastic surgeons. Plastic surgeons are we do cosmetic surgery, but the majority of our practice is based in reconstructive surgery. The training that we go through for reconstructive surgery is massive. For instance, I had 8 years of surgical training following medical school before I even saw a patient. So that is extremely important to understand that there are people out there that call themselves cosmetic surgeons that aren't adequately trained. And adequately trained, by that I mean a board certified surgeon. Now you can belong to the board of cosmetic surgery because I can send them in. I can pay a dues check every year as well, but that doesn't mean it's recognized by American Board of Medical Specialists, which is what the American Board of Plastic Surgery is. That is a very intensive amount of training. So yes, I am a plastic surgeon, and I do answer questions that are outside the realm of plastic surgery, but I also have MD after my name, and I've spent a lot of time in school. So you're right, I think the listeners have to understand that my specialty is plastic surgery, but also I am not we're not going to move over into other areas, and I'm very careful to say when somebody needs to see a specialist. So that's important to understand, but it's a good comment, and I appreciate it.
It is a good comment, but yes, Dr. Downs is very much qualified to answer all medical questions, and if he doesn't know, like he said, he'll refer to a specialist.
But also, when it comes to plastic surgery and my specialty,
yes,
anybody out there that's looking to have a cosmetic procedure or even a reconstructive procedure, when you go to the surgeon, make sure they're adequately trained. And just because they say they're a board certified surgeon, they may not be board certified in what you're looking to have done. For instance, there are a lot of people in this country, there are OBGYN doctors in this country that are doing breast augmentation, liposuction. There are general surgeons that are moving over into the plastics realm because it's cash. And everybody wants to get into that field, but they're not adequately trained. So please, buyer beware, caveat emptor, the whole thing. Make sure that you see one person, two people, just like you would for your heart, maybe get a second opinion. But it's important to make sure that the qualifications of that person are adequate enough to take your life in their hands.